first time, just getting ready. Let me be honest, I don't know one single thing that I haven't done to make you notice me. Let me be real here. When I see you, my heart starts racing, but I don't know if I like this chasing and playing and waiting around. It's a shame that my hands start shaking all of the time when you're around me. But this time, girl, I know what's bothering me. I need somebody to love. Oh, nah, 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 nah. Don't you see what's wrong with me? I need somebody to love. Oh.
Today is September 11th, 2020, Friday of the 23rd week in Ordinary Time, and you are tuned into Deacons, Discussions, and Drinks.
When you don't have to, there's so much that I'm still keeping to myself, 'cause you don't listen, babe, but still you got me missing you. When I see you, my heart starts racing, but I don't know if I like this chasing and playing and waiting around. It's a shame that my hands start shaking all of the time when you're around me. But this time, girl, I know what's bothering me. I need somebody to love. Oh, nah, 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 nah. Don't you see what's wrong with me? I need somebody to love. Oh, oh, nah, nah. God, I'm sick of this waiting. You come and going.
Good evening, everybody, and welcome to another episode of Deacons, Discussions, and Drinks. I'm Deacon Tim Stout,
I'm Deacon Dallas Kelly.
I'm Father Lynn Wynn.
and yes, we're back after taking a week off. We're back in the studio at Cardome, and we have Dr. Ryan Stanton
Hey,
in our house. Hey, Doctor.
how are you?
Good. Welcome to the show.
Well, I appreciate it. Thanks for bringing me in.
Obviously, at this time of a global pandemic, doctors aren't that busy, are they?
No, what interestingly is it actually turned down. I mean, we lost 60% of our volume in March and April, so we are actually just now getting back to our usual business.
Crazy.
Yeah.
Crazy.
You never thought that during a pandemic that doctors and nurses would lose their jobs and get furloughed and pay cuts and all those things like that. It's like welcome to the pandemic.
Well, that's your supply chain, right?
Oh yeah, absolutely.
So just on these mics, I have to remind these guys all the time, just get close as you feel comfortable to.
I'm just going to speak loud enough that I'm on one of y'all's mics too.
No, don't do that. So I'm going to do an intro of what the education that I've learned from you, and then I'll let you do your own intro, okay? So board certified emergency physician at Baptist Health Lexington, 28 years TV, radio, and print.
Mm-hmm.
Work with the Lexington Fire Department,
Absolutely.
City of Lexington. Work with NASCAR, AMR safety team there, which is pretty cool. I hope we talk about that. President and officer of all kinds of different medical organizations, past, present, I guess, and graduate of East Tennessee State University, home of fill in the blank.
Well, the Buccaneers, as well as one of the best country music artists of all time, Kenny Chesney. And I actually took guitar lessons my fourth year of college from the same guy that taught him. I did not pick it up like Kenny Chesney did, and that's why I'm not on the back of the book they use for education.
I had Kenny Chesney. That was the number one alumni of East Tennessee State.
Well, that is definitely the number one alumni of.
Can you name another one?
Well, we've had a couple of. Well, who was the general? We had a really high-ranking general that was there that did a lot of things. Now, interestingly, I was there forever, but my dad was president for 15 years.
Oh, of the university?
Mm-hmm.
Oh, wow.
Yeah, so
cool.
that's one reason I'm up here, is because I couldn't do anything out there in East Tennessee without being
his son,
Paul Stanton's son.
That's,
Junior.
That's a good reason. That's a good reason to leave for sure.
Spread your own wings.
The other famous alumni that I saw, because everybody likes Field of Dreams, the TV, the movie. Kevin Costner's brother-in-law, Timothy Busfield, is a graduate of East Tennessee State.
Okay, you could have hung me out and said you are going to die if you don't get this one, and I would not make it. I would not make it.
So that wouldn't have been. You also have a Survivor contestant from there.
Yes, we do have it. Yes,
Tom Buchanan.
And it's not surprising because we're up there in the mountains. And so it's a beautiful place, a lot of outdoor activity. Everybody around here says, man, there's a ton of lakes around here. And I was like, are you kidding me? With the TVA, I had 5 lakes in 30 minutes.
Oh, wow.
Like if I had a couple of extra hours, I would just walk up, just take out the little John boat to the lake. I used to study. That's how I got through med school, is me and my best friend would go out on the lake and do catfishing all night while we were studying medical school.
There you go.
There you go, Dallas.
Somebody else fish,
Yeah, he's a fisherman. He just bought a boat.
I didn't say I was good at it.
We could do a medical show from a fishing boat. We're talking about
Okay.
doing one of our shows from a boat. So.
Well, to let you, if it gives you any idea of the quality, I'm able to study for medical school while fishing. So, and I finished medical school. So, clearly the fishing wasn't that good.
So you're not plugging East Tennessee State Medical School? So you did your undergrad and your med school both of
I
them?
did. So East Tennessee State University had an early admissions program. After the first year of college, you could go ahead and take the MCAT and test into medical school. And at that point, you'd be accepted after the first year interviews. And then you did a certain number of courses your sophomore, junior, senior year that got you ready, prep for medical school, and then just rolled straight into it. If I love the medical school, I love the people there, love the environment. If I would have thought better, I probably would have gotten a little bit better grades if I didn't have all my best friends, none of which were medical, still down there, that were still saying, hey, Ryan, it's Monday Night Football. We should go down to Shoeless Joe's and eat some wings and watch some Monday Night Football. I'm like, yeah, that makes sense. I can study there. It never worked out that well. There's certain things. Kids, if you're thinking about going to medical school, get away from friends. It is best to be just live in a cave gnome at that point.
There you go.
There you go. That's a good advice, yes?
I don't know anybody's going to medical school right now. I think COVID might be scaring people away from medical professions. Yes? No?
Well, it's potential. It's very interesting. I think a lot of people, once this is said and done, I think you're going to see a decent wave of folks leaving the medical profession. Just because it's so taxing every day thinking about the fact that you're going in and exposing. So a lot of folks, when you think about it, you think, well, maybe I've been around COVID or maybe I've been exposed to COVID. Well, I know I've been exposed to it every day that I go to work, like probably 3 to 5 patients just right in there, and it's there, and you just hope that in the end that your mask is fit well enough, that you've used enough hand sanitizers, hand washing, you're changing your clothes. Nobody in the hospital anymore is wearing their own scrubs. I used to wear my own scrubs that I had that actually fit me well because I'm tall enough that scrub makers, there's no scrub maker apparently that's over about 6'2". Because they just make them wider. And so it's like I've got this giant tent on my rear end that's still ready for a flood. And so we're all wearing the hospital scrubs. We change them out. We leave everything there. We're using disposable stethoscopes, wearing a cap. Everything's covered. And I think we're all a little bit ready for this. I think of course, everybody, across the country, around the world is ready for this to be over.
Yeah, I think for me, the mental side of it has really kicked in for me the last couple of weeks.
There's been a lot of releases just over the last couple of weeks about the mental health impact associated with COVID, and it truly is. It's going to be huge. I mean, we congregate. We like to be together. We like to see faces. We like to touch. We like to, just do the things that we used to do. And that separation and not being able to see faces and facial expressions, and even though you want to hug somebody, you can't hug somebody, and
shake
all
hands.
Even shake hands.
Yeah.
And those are the things that are being pulled away, and it, not to mention the underlying mental health issues within the United States, not access to treatment, but also throwing this on top of it, employment uncertainty, school uncertainty, a lot of food security uncertainty with a lot of folks out there. I think the victims of COVID are going to be exponentially higher from the external aspects than just the virus itself.
So some form of PTSD for COVID in a way.
PTSD, exacerbation of depression, and there's a lot of people live with behavioral health and psychiatric issues, and if you throw this curveball in there, and if you can handle a quick curveball, you can handle one curveball. But if that pitcher stands up there and throws 9 innings of curveballs at you, each one a little bit different, that's what we're dealing with. And I think everybody expected this to be 2 weeks, a month, 2 months maybe. Well, this is actually going to push a year easy.
Easy, yeah.
And we're 6 months into it now. 6 months and about a week from the cases here in the U.S.
Yeah. I was at a trade show in Vegas the day sports died.
Mm-hmm. I was in a fire suit about to head to the Atlanta Motor Speedway.
I remember walking by the sports book and everything had been canceled. March Madness got canceled that day. Baseball, spring training got canceled. All that, and somebody had wrote on a piece of paper and left it on the sporting book that said, "Sport has died."
Yeah, and it was just this vast emptiness of anything. So you're stuck at home, but there's nothing decent on. And of course, Netflix spikes because we're all start binge watching just random shows. Just because the sports are gone, and we took a break from NASCAR from, I guess it was early March. I guess that would have been the first weekend of March into February, beginning of March, all the way until middle of May when we restarted again with Darlington. It was the same, me and the same medic, and so we actually took a picture when everything was canceled, sitting in the hotel room with our fire suits on, about to go to the track, because we'd already started preparing that they had canceled fans. We were not going to go do any of the interactions, the meetings we usually do before. We're putting on our uniforms. We're going straight to the chase trucks. We're going to the race. That's all it's going to be. And our picture in the middle of May at Darlington was us in the RV that we've got there, same uniforms, about the same distance apart, socially distanced even to that part, to get racing back going again. And since then, I think I've done about 15, 18 weekends since we've gotten back going again.
Yeah, because NASCAR was one of the first sporting events to start back
It was.
up, right?
So the ones that had returned, you'd had a couple of small things. MMA did an event like the weekend before. MMA's done a fantastic job in terms of their planning, of course, Fight Island and that sort of thing. But then NASCAR was the first large event. And so actually they're racing right now. The Xfinity Series is racing right now in Richmond. And so I screen the forms each night. We send forms to everybody. It's super restricted. Even the owners of the cars can't go in the infield. You have to be somebody that's actively participating in getting the race on the track. So everybody else either has to stay out or can't come. So it's very, very restrictive. And we average about 1,000 to 1,500 people that make a race happen. And interestingly, we've only had about 2 or 3 dozen cases in 5 months or so.
Which is, from a percentage perspective, that's pretty good.
And none from actual track. And so we've had about 50,000 total people at tracks, and we've had just only external cases. So we've prevented any spread from inside the track, which has been huge. And hopefully the blueprint we're seeing in other races and other sports as well. So we've had a lot of interest from the other sports on how it happened, how do you distance, how do you screen, what are the things you do. So we have the pre-forms that we have beforehand, and then when you arrive at the track, check a temperature, confirm the symptoms. You get a sticker for that day. So even if you have a card that says, I started NASCAR, you're not getting in unless you got the sticker for that day that says you're allowed to be here that day.
Oh, wow. Pretty cool. NASCAR fans, you ever been to a NASCAR race, Father?
Yeah. Consider Indy 500. Is that NASCAR?
Well, that's Indy. So it's close. Now, just don't tell my NASCAR friends.
Yeah, that's not NASCAR.
That is. So Indy. So the way I got into it was actually here at Kentucky Speedway. Well, I grew up next to Bristol Motor Speedway, so I was a fan forever. And then when I moved up here with the University of Kentucky as a resident, we had the contract to do the infield care center and fans for Kentucky Speedway. And at that point, IndyCar and what is now Xfinity raced on the same weekend.
Right.
And so, I mean, the difference, the stock cars they're big, they're heavy. The Indy cars, they're small. They're almost like ridiculous fast. So you're thinking about speeds at Kentucky Speedway on the Cup cars of about 180, maybe pushing 190. The Indy cars were like 215, 220.
That's a big difference.
And it was just ridiculous how fast they would go. But so I love all types of racing, and actually the company that we work for, AMR and GMR, actually has the contract for IndyCar, IMSA, and NASCAR. So we all work together with a motorsports forum to share information, because IndyCar's had a great program for a number of years, and this is the 4th year of NASCAR having a traveling team.
I just watched the Indy race this year, and the cars have changed.
Great.
Yeah, and the cars have changed so much in the last couple of years that if you haven't watched in a couple of years, you look at the cars, you're like, wow.
Oh, so that the new Halo that they have,
Right.
Interesting for the show we're on. So the new Halo they have is actually, there's only one tool in the country, the Jaws of Life tool, that can cut that. And it can only cut twice before they have to replace the blades. Each set of blades is about $5,000. So they can remove that Halo within about 2 minutes, because now they have a hard time accessing the driver. But that Halo is designed just to protect them from an impact into the fence or whatever it may be. And so it's impressive.
Yeah, it's from a safety perspective, that's probably one of the safest sports out there.
Mm-hmm.
Yeah?
Mm-hmm. And
Or
it's
racing sports.
I think it's, I believe, I can't remember, I think it's a single piece of titanium that makes up that halo. So it's pretty impressive.
NASCAR fan, Dallas?
No,
Never?
never have been.
I think Bass Pro Shop sponsors a team.
They do.
Yeah, I've seen their emblem.
They've got
on
a
car or
partial.
something.
They've got Camping World does the actual truck series and the Gander.
That's right. I forgot about that.
Camping
We
World
have-
Gander.
We have a Camping World here in Georgetown, right? And
So, see, you could do a show from the Speedway.
that would be cool.
I introduce you to NASCAR, and we talk about it over.
Okay. Where do we sign up?
As soon as we get fans back, we'll make this happen.
Yeah, it's
We actually do have some. Actually, the Bristol next weekend, I'll be working Bristol. They've sold it out, 20,000 tickets for that race. It's still, I mean, the place holds 140,000. But
that's my
you know,
dream. I've never been to
20,000.
Bristol.
Oh, it's incredible. It's incredible.
Been to Talladega a couple times.
Talladaga's a
Pretty
different
cool.
bear.
Yeah,
you
totally
can fit
different.
like half the tracks in the NASCAR within
Yeah,
Talladega.
And Talladega's like in the middle of nowhere.
Most are in the middle of nowhere. I mean, where you can say I can have 100 acres and build a giant road that is in a circle. There's
And-
not many
and make a
places
lot of
You're
noise.
not going to do that in downtown New York.
We did it in Gallatin County up by me. So.
So interestingly, Martinsville has noise ordinance. So you can't race a certain time in the morning, especially on Sunday. So there can be no noise. There's no practice on Sunday mornings at Martinsville. And after a certain point at night, even though they did put in lights, they can't race because the noise ordinance is there.
Wow. What goes on Sunday that's important? The blue laws are still in effect.
Oh, very much.
Right. So we didn't ask you to introduce yourself, or we were, but we kind of got
sidetracked.
we went 0 to 60. So if you had to,
15 minutes into it, and I'm just now introducing myself.
so if you were meeting somebody on the side of the road and you were going to introduce who
Well,
is
I'm
Ryan
introducing
Stanton,
myself. I just introduced myself as, hey, I'm Ryan,
right?
because the other stuff is
But that's what
just
we
there.
want. That's
But,
what we want to talk about.
Yeah, so it's technically board certified emergency physician, meaning I did, and very few people actually realize that emergency medicine is a specialty. And so I did 3 years of training in just emergency medicine. So it's acute care, trauma. It's everything that is emergency medicine. So board certified in that. So I really can't just walk out and hang up my shingle and do something else. I guess theoretically you could in general practice or something.
Yeah, you can't just go be a family doc.
Well, I could do family medicine, family doc type stuff, but I just can't walk out and say, hey, today I'm going to do some, neurosurgery. I'm going to start working on some brains. I've got a little bit of a tremor, but let's see how this goes. So an emergency physician here in Lexington. Actually worked here at Georgetown for a while. Love the hospital. Probably the most efficient hospital I've ever worked for. Thank you, Toyota. They've done some stuff there. I mean, you can get stuff done so quick there. Then medical director for Lexington Fire and EMS, as well as the airport. And then the NASCAR gig was the infield care center, but over the last 4 years has been with the AMR traveling safety team. And this year is my first year. Thank you, pandemic, as the medical director for that team. Because we transitioned January 1st, I'm thinking this is just we've got this as a well-oiled machine. And then we had the big wreck at Daytona, and then followed by a pandemic. And so it has been nothing. I mean, we thought we were just going to be an on-track resource for NASCAR, but now we're in charge of the COVID response and screening and monitoring and decisions on who gets to go and who stays home. I was like, man, this is we need to renegotiate this contract.
you probably aren't just using a handheld thermometer either, are you?
Well, no, it's actually the basic one is just the no-touch thermals. I mean, if we're doing 1,500, now if we have to do a secondary screening where we're determining if they get to go in or not because their temperature was high, like they drove with no air conditioning on or the sun is beating down on them.
Which happens.
It does. A lot of people do that. Then we actually use the oral thermometer. We always threaten with the red thermometer, but we don't use that. We have not used that.
We have a thermal scanner at work too that we figured out when we first installed it was right underneath the air conditioned duct. We said, okay, that's no good. We got to move that because cold air blowing right on somebody and you shoot them with the camera. And
One has to be pretty close to. So it's actually more of the body camera. It's not the real close.
No, it's a camera that sits on this wall and about, I think it's 6 feet away is a known temperature source. And it's in the picture with them and it scans them and the source and it does an algorithm and it's
We
pretty
actually
good.
looked at that for the initial fan scans at Indy So when we were going to do Indy, the Indy 500 was initially going to have 150,000 fans.
It's a lot of people to process.
And then it dropped down to 50,000. Then 2 weeks out, they said, "Hey, we're not going to have any fans." We're like, "Well, we'll scrap that." And I think that plan is actually going to be used for Phoenix at the end of the NASCAR season. Put all that in, but initially it was a scan like what you're talking about. But then looking at the potential of handheld scanners and what do you really want to know?
Right.
And what information? How are we going to make sure it's accurate? What we don't want to do is get false positive temperature readings, but we also don't want to admit somebody that's the potential of making a super spreader event.
Yeah, like 103-degree temperature or something.
Yeah. And I'm pretty sure most of those folks that come in with 103, we can identify. I mean, you look like death on a cracker at that point.
Yeah.
I mean, you look pretty puny. If you walk up to me with 103, you're not going to hide it and say, "Well, I'm just a little out of shape." Like, no, you look like you need a hospital.
I just climbed up a couple flights of stairs with some camera gear like Steve does when he walks in here. So,
You guys are not gonna make
I've seen Steve do the walks at the Bengals games. He likes to park about 8 miles away.
that's no bueno.
Well, it's not bad on the way there because it's downhill to the stadium, but it's uphill the whole way back.
NFL's going to happen.
Yeah, watched the
Yeah.
game last night.
Yeah, it was
Part of it.
Yeah, it was an interesting game. The fan, Steve and I were talking about before the show that the fan noise. Did you watch the game? Did you watch the game? The fan noise for how many people they had was.
I think they had about 20,000.
Yeah, I mean it was loud. I mean, if you wouldn't have known that there were half or a third or whatever the capacity was, you would have thought it was just a normal crowd.
Yeah, about what we expect in a Bengals game.
Oh.
Low blow early.
He had his headphones off.
Yeah.
He didn't.
Yeah.
He didn't necessarily.
20,000 fans. Like, we don't know where we're going to get all these extra people.
They do.
So the Bengals have no restrictions this year, right?
No, they're still at full
They
capacity.
just come. Yeah.
They do have the #1 draft pick. I mean, he's going to bring some people.
He's actually going to be pretty good. And there's some chatter that they're going to. I still think they're picked at 4.5 wins this year, if you look at the lines on it. But it looks like they're going to be. There's a decent chance support that they're going to get past that. That Burrow's going to be a decent addition to that team, and I think it's at least going to make it exciting. Because my thing with Pryor was just waiting for who's going to get injured next. Like, how long is, as Colin Cowherd called him, the beige water pistol? When is he going to injure himself? He'll break his thumb or something. And when's AJ Green going to go down?
It's true.
See,
Were you at the game with me when the Pittsburgh Steelers guy went down? He got hit.
The paralyzed.
Yeah, he got paralyzed.
Oh, yeah.
I mean, that game was very eventful anyway for us. We were in the it's upper deck. It's zone DRUNK, drunk. It's the drunk zone we were in, and the guys behind us. Whoa, we now know why the NFL or the Bengals put up on the splash screen. If fans are out of control, call this number.
Well, that reminds me, my first NASCAR event was actually at Bristol Motor Speedway as a Boy Scout, because if you wore your uniform, you could get in for free. And they only sat 50,000 seats at that time, and you sat up basically in the low traffic patterns for the airports, like you were
Right.
talking about for the Bengals. And we called him the human bowling ball. And as the race started, he kind of stumbled a little bit. And he'd clearly been priming. And so he kind of stumbled a little bit, and each kind of time he'd go to the bathroom. And, of course, this time got shorter and shorter and shorter. He keeps stumbling more until he starts falling and falling. But right before the end of the race, he doesn't even go to the aisle. All of a sudden, we look, and he's rolling down the bleachers, just grabbing coolers as he goes, just tearing stuff down, and makes it probably 50 rows down until he hits the rails that stop before you go over the edge. And after that, I was like, I'm a fan. I'm hooked.
I had to tell Deacon Tim, I'm 2 weeks out of neck surgery. If we get in a fight, you're on your own. Okay? It was getting pretty bad.
It was bad. This guy, first of all, it was a Monday night football game. Okay, so they'd been drinking since noon.
Mm-hmm.
So it's 9:30 at night, and this guy's mad at us because we're not standing up the whole time. And he starts grabbing me, and I'm not a big dude, but I'm not a small dude either. And he was a small dude.
puny small.
And finally, I turned around to him. I said, "Look, man, if you touch me one more time, we're gonna have a serious problem. Get your hands off me. I mean, I'm here to watch a game. I'm not here to have you drunk vomit on me, whatever's going to happen, and grab me the whole time. It's just a surreal experience.
That's one of the challenges of football now. It is hard to take kids to a pro football game because there is so much. It's
crazy.
Well, there's so much debriefing you got to do afterwards, during and afterwards. You got to say, kids, okay, we're going to start with number 1 here. Number 1, we don't act like this. Number 2, we don't talk like this. Number 3, we don't treat other people like this. Number 4, try water on occasion. I mean, just run through the whole list of everything that you go through. And you'll see a lot of places now, and I think the Bengals actually have a family zone. But I know that Bristol and a lot of the speedways have family zones too, that you can take your families and not have to worry about that type of activity.
No, I was with a guy I work with, Baptist preacher, and his son, and he actually got up and left before we did. He said, I can't. You know, if it gets to that point, that's a problem. You know, where you can't watch a game.
If it takes away from the entertainment.
Exactly.
What you're there
And
for.
what was funny is before we went in, the last pro football game I was at before that was, it seemed like 20 years prior. First time the Bengals ever played the Dallas Cowboys. Danny White was the quarterback of the Dallas Cowboys. And my boss took me to the Bengals game and Dallas Cowboy game. And it was horrific, just like we experienced. And as we're walking into the stadium with his friend, I warned him. I said, just want to let you know, the last football game I went to, here's what happened. And I described it, and that's exactly what happened.
Yeah, you're going to check out 2 services next Sunday to clean this stuff off.
No, it was bad. And it was a blowout, I think, or something. He eventually found a seat down in the lower bowl by himself on against the wall with his son, and they got to enjoy the rest of the game. We moved too, I think, and it started to rain. We left a little bit earlier or whatever. But you know, the NFL's got a lot of issues to deal with, and that's probably not high on their list right now.
No, for them right now, it's just making things happen. Well, and that's actually anybody in professional sports. I mean, you're talking about that the college football game has been postponed tonight. It's the fact that you have a schedule, but you don't know if that schedule is going to happen. I mean, until you are on the field or on the playing surface or whatever it is, and there's a go, the whistle blows or whatever, you don't know that it's going to happen. I mean, even with NASCAR, you know, not only have we moved a lot of races because of state restrictions, but we just know that there's one big outbreak from a potential significant delay or cancellation. And so I think that's what really drives a lot of this, especially those that are dependent on the paycheck. You know, a lot of these crew members and things that we deal with are living paycheck to paycheck. I mean, it's not a huge living, especially when you're talking about the lower series. And they understand that if they mess around, make a bad decision,
Make a bad choice, whatever.
high risks or whatever, they may lose their job and profession for the year. And you know, I think every sport is looking at that is that calculated risk. We're going to have cases. How many? And then what do we do? And do we have a super spreader event or a large outbreak that's going to sideline this entire process?
Yeah, I think that's what the prediction was for the Major League Baseball, right? That's what the first – was it the Cardinals who was – no, it was
The Mariners.
The Mariners, yeah. They obviously thought that was going to be – and everybody was predicting that's the end of the season. And they've done a good job of managing it, I think.
Interestingly, if you look at it, that got a lot of press because it was MLB. But if you look at their number of cases, it's still tiny. They've had very few positive cases. I mean, if you look at the sports that can do a bubble, those are pretty incredible. You know, NBA has done a fantastic job in terms of COVID safety and managing their aspect, but a lot of sports can't do that. You know, baseball is still a larger team sport. Football, even larger. You know, you can't really do a, quote, bubble and those types of things. And so then you throw in, if you can control the entire environment, then you can control it and prevent COVID. But when you can't control the entire environment, you just have to understand the risk, and then everybody has to understand that you are not guaranteed to be there on game day.
And we've done a good job here at our school, right?
Mm-hmm.
So far, knock on.
But the interesting, I learned because we open our school, of course, we've been pressured by the health department because we follow CDC in regard to social distance. If kids in the classroom 6 feet apart, they can take the mask off. Like right after Catholic Church in Kentucky decided to open it, all the governor's not happy with that. So the health department came after us, pressure the superintendent to make sure every kid wear a mask at 8 hours every day, nonstop. Few Lexington Christian did not. few schools that against it, and they put a lot of pressure on them.
Yeah.
Unfortunate.
Yeah, my kids are at in Trinity in Lexington, and they're back in live school. And we're expecting at some point that we're going to be on delay and quarantine, everybody go home for a couple of weeks. We expect it to happen. But we also know the stress and strain that we're seeing with families that are trying to make, with the number of single-family homes and both working homes, trying to make these things work and teaching your kids. And I saw something on social media earlier today of a child sitting in the parking lot of the school because they didn't have social media. I mean, they didn't have internet access, so they're trying to reach the Wi-Fi so they could do their homework and they could do their schoolwork. And that's it. I understand we are dealing with a pandemic, but we also got to try to do everything that we can to make families in life function. And if you're trying to, in fact, my sister today, she's a pediatric physical therapist in Virginia, and she's talking about how terrible it is dealing with the fact that her kids, all three of her kids, but two of them are school-aged, at home, dealing with all their schoolwork while she's doing virtual appointments and everything going on. And it's just, it kind of goes back to that whole, everybody's tired. Everybody's just worn out from COVID, just mentally, emotionally, physically.
There's nothing that is normal anymore.
No.
Nothing.
If we can get the Back to the Future machine and Marty McFly shows up here, I guarantee you 2020 is not going to be putting that dial.
Hey, the only thing that's probably normal is fishing. Is fishing normal? I mean, when you get out there on the water by yourself or with your fish?
No restrictions, no nothing.
Essentially, that is the super version of social distancing. Because so far we've learned that tigers can get COVID, maybe dogs can get COVID,
And
but
salmon.
But
I read a couple days ago. Salmon.
Good news. We're not in salmon country.
We're not in salmon.
There's
Thank
no
God.
salmon.
Thankfully, trout and bass and bluegill and crappie.
Catfish.
Catfish.
No.
They're clean
Wow.
So far.
so far.
I just got a delivery of salmon today. Oh no. But not transmittable. Cannot be transmitted from animal to humans that we know of.
Not that we know of, but of course, as of 6-8 months ago, there were no experts in COVID. And so this is the first time that I have seen, and of course I think since probably modern medical history, that the entire disease process of learning about it, discovering, researching, has played out in the public venue. And so you're seeing stuff playing out on social media, on the news, and that's where a lot of angst has come, because these things get pushed out before they're ready for prime time, where they would play out in medical journals, and then they would be picked apart and researched and studied to see if they were legitimate. But they're playing out on social media and they're playing out on the news, and then everybody gets upset. They're like, well, what about hydrochloroquine? That's the cure. We already have it. There's a study that says it works. I was like, well, actually, there's one study that says it may work that's should have motivated further studies, and now there's been 3 studies that show it's not helpful. And so don't get hooked on something that's early news ready to play out, that actually takes your eye off the ball on what we actually can do to help people.
But that's against our culture now, right? Because we want immediate. We want now. We want to have a solution today, and so
we do. We want that instant gratification and satisfaction. But also, when you're dealing with a pandemic, people just want hope. They want to see the light at the end of the tunnel, and that light not being a train. They want to be able to see that look, we got a way out of this. And I think right now what you're seeing is that a lot of people are kind of like, is this new? Is this the new life we're going to live the rest of our lives? And it's not. We are going to see here in Kentucky, we're going to see the cases kind of roll like they are now for another couple of months. They're going to start to tail off. We're going to deal with flu season, which hopefully, if Australia is the indication, it's going to be a very mild flu season because of the steps we're taking for COVID. We're going to get a vaccine, and then sometime in 2021, we'll get back to as close to a normal as we can find.
So we won't be wearing masks at Christmas in 2021, you think?
I don't think so. No, I think we'll be out of it. I think some people, interestingly, what I think will be a very interesting cultural change is how many of us continue to wear masks like we see in a lot of cultures.
And if we'll shake hands again.
And I'm okay with that not happening. If you realize how many germs are on their hands and what a lot of people do with their hands.
But it's just that's such a part of our culture.
It is. But I think the fist bump, the elbow bump, the air fives, all those things that's what we do in NASCAR now. We used to do, high fives and fist bumps, but now we do air fives, and they work just fine. And then I don't have to worry about washing my hands after I meet somebody every time.
I guess I'm just old school.
It
Are
is.
you old school? There's something about, and Gus Lloyd said it best. I like to hug people.
Well, maybe you should just go overboard and just go ahead and get those European cultures and do the cheek to cheek kiss.
No. Come on.
I mean, if you're gonna do it, let's go full Monty.
Are we ready for a question?
Yeah. We have a question.
Yes.
I do have the phone line open too, but I didn't plug that. If you can get that number ready, Steve, we'll take
He's
it.
actually hung up on like 5 people already.
Do you feel like the COVID numbers that are being reported are pretty accurate? And what do you think about the reports of only 6% are actually COVID only with no underlying conditions?
Okay, so actually the second question, the 6%,
So that was for Tim. No, I'm just joking.
the 6% is actually incredibly accurate because we know that very rarely does death happen in a vacuum. It is rarely a single causation event. And we know with COVID, with obesity, hypertension, diabetes, other chronic conditions, that significantly increases your risk. And so if you pass away and I do the death certificate, I list the primary cause and then everything that contributes. So when that says 6%, that's saying on 6%, they only list COVID-19. Well, I rarely ever list just one diagnosis because there's always things that work into it. So if you die of cardiac arrest, from myocardial infarction, from coronary artery disease, by hypertension, from smoking, from obesity, from hyperlipidemia, from diabetes, all of those things go in it because they're all contributing. So they
all get listed.
So they all get listed, primary diagnosis and contributing diagnoses, because the humans rarely just drop. There's always things that kind of work together to make things happen. As for the numbers, I think the numbers are I think we're missing just as many as we're over-reporting. Now, I think there's certain places that have probably done a little fiddling with the numbers for whatever secondary gain they want to do. But for most numbers, I think we're probably getting decent. And the important thing I like to stress is not the actual down to the individual hair on your head numbers. My interest is where are trends going, and most importantly, what type of complications, admissions, intubations, and deaths that we're seeing. You can't really mess up deaths. Now, we're all seeing those memes of 2 people die in a house fire from COVID, or 2 people die in a meth house explosion from COVID. You know, and I understand that narrative.
I haven't seen that one.
That one's popped up this week, and I understand that narrative. But you know, looking at the tests are missing a lot more than they're catching.
So are you saying false positives cancel out false negatives?
We think that we're actually missing more than we're actually overcatching. The tests, anything that's rushed through, especially the cheaper tests, there's a lot of false negatives. We think there's false positives too because a lot of those PCR tests pick up RNA fragments, not actual infection. So there's only a couple of tests that actually look for acute infection and detect that. And so we are just picking up, when they do that swab up your nose, all they're looking for is the RNA fragments. Are they infectious? Wasn't it exposure? Is your body going to fight it off and you're not going to actually get an infection? So those are going to be the false positives. It's there. It's just not an active infection. But what we're finding is a lot of clearly COVID patients, we're testing 3 and 4 times before we get a positive. So we think there's a lot more false negatives than false positives.
But what you just described prior to that, where they've been exposed, they have that RNA fragment, is different from somebody that's has it and is asymptomatic.
Right.
Okay.
And and the thought is with the purely asymptomatic that the risk of spread is pretty low, and you probably don't build an immune response either. So you may have an infection, but your body, it just doesn't go, your immune system doesn't get fired up. The symptoms you experience with COVID, the vast majority of symptoms anytime you're sick are actually your immune system. It's not the infection itself. It's the immune system trying to fight it that's causing the other symptoms. The inflammatory responses, all the things that are having a fever is not an infection. The fever is your immune system trying to make the environment uncomfortable, like 3 lights in a room with 5 dudes. We're all sweating a little bit.
You wouldn't like it in here a few weeks ago. This is comfortable.
Yeah. So your body's doing the same thing. Your body's trying to, when it builds a fever, it's trying to turn the world into a sweat box to where, say you've got a party at your house and you're ready for everybody to get out of there. Well, you just turn the temperature up to about 100 degrees and everybody wants to leave. much less make more viruses. And so that's kind of what the body does with a fever, and the immune response is just a secondary aspect of things. And with COVID, a lot of the deaths and complications are actually the overstimulation of the immune system.
Wow. That's a lot to take in. Hey, let's throw this phone number up there, Steve. You got that? You got that ready to go? It's 1-657-332-2667. That's 1-657-332-2667. 657 Deacons. We'll take a call if you call in. Dallas is obviously getting comments on Facebook. You got another one rolled up?
That's the only one.
That's only one. You got anything on your social media?
I'm already tell that it's warm enough though that I'm getting red cheeked. Well,
that's the camera guy.
Combination of the water that we're enjoying and the
bottled water
and the temperature. Yeah.
Yeah. So it was mild today. It was only 74 degrees.
It felt great today.
It
was
did.
beautiful.
I got a question for Doc here.
There you go.
A person has a friend in ICU for 17 days on oxygen daily, testing COVID negative.
Mm-hmm.
Very healthy man, but has all the symptoms.
Mm-hmm.
How can we trust a vaccine when false negative are not capturing those who are clinically positive? How can we trust a vaccine when the positive are not being physiologically being shown as positive?
Well, I think the vaccine's a different story. The vaccine is the only issue with potentially having it and not knowing it and getting the vaccine is that your immune system's already tanked up and ready to go for COVID, and you get the vaccine and you're going to get some symptoms from it because the immune system's like, oh crap, it's back. We're time to fight again. And so you're going to get some symptoms. So when people get the flu shot, they say, I got the flu from it. It's really just you already had an immune response. And when it saw that coming in, it said, everybody, they're attacking us again. It's time to fight. And so it goes after it. And that's why you get symptoms. So you don't actually get the flu. Now, one of the things you're talking about, somebody's in the ICU for 17 days, it probably is COVID. We're just not picking up the symptoms. And that's what I'm talking about. The tests just aren't really sensitive. They're very specific if it's positive. So what we tell people, the tests are really only valuable if they're positive. If they're negative, pretty decent chance, but not guaranteed that it's negative. The thing we're also seeing, though, is in that case, the patient may have legitimately already cleared COVID. They may just be having the secondary effects. We are seeing people coming in the emergency department now that 3 and 4 months out are having shortness of breath, cough, headaches, symptoms left over from COVID well after it's cleared. And so they're going to test negative, but that damage and the things that were done from the immune system and from the virus are still producing symptoms.
I know that person.
That's
in our church, yeah.
Yeah.
She, over a month and a half, still positive.
Mm-hmm.
So the health department released her, and she have all the symptom, that hard breathing, all of that.
Interestingly, the CDC has found that their new recommendation is once symptomatic, it's actually you have a longer time quarantined if you don't have symptoms. If you don't have symptoms, you have an exposure, it's 14 days. But if you get symptoms, their recommendation now is 10 days after you become symptomatic, because what they found is that you're most symptomatic just before the symptoms start. And then as soon as the symptom starts, the risk of you spreading it goes down significantly. And so they're seeing that after 10 days, it's incredibly rare that somebody can actually still spread it at that point. And now some of that is trying to preserve the workforce and things like that. You can go back to work in a healthcare setting 24 hours after the fever resolves. But, I think one thing that we've learned from this over the last 6 months is that the biggest risk is right before symptoms.
Mm.
So crazy.
Oof.
Everything we learned.
Oof.
Yeah, everything we learned in the beginning is almost reversed in a way. I mean, it's almost like, I'm going to use a Star Trek reference here, Kobayashi Maru. It's like it's an impossible to make good decisions, long-term decisions. You're making decisions based on the information that you have, and most likely that decision will, if you look back on it 30, 60, 90 days later, it's going to look like a bad decision.
Well, WKYT decided to bring up my first interview on this last week, what I expected back in late February and early May. I mean, late
March.
February, early March. The other M1. And they, and it's, of course, I don't think it's going to have a huge impact. We're going to see a little bit of it stuff. Just do the things that you need to do. And the advice was still, masks, distancing, hand washing, that sort of thing. But the last 10 years, almost every year we've had the next big pandemic. And it doesn't happen. I think Ebola was the closest, but we had chikungunya, we have Zika, we had all of those things that happened. H1N1 came through, and it was big, but it was still the flu.
Right.
It just hit populations that flu typically doesn't hit. And so I think we all at this point, if any professional in the healthcare industry can go back and tell you they were right about everything with COVID, they are a bold-faced liar or have no idea what they're talking about. Because every single one of us has not only been humbled, we have been proven wrong time after time. We've adjusted our narrative. And so anytime anybody posts something from March and says, well, it says it right here, masks are useless. I was like, that was March. That was before we had a big pandemic. That's when we were worried that China was the super spreader.
Right.
Now we are the super spreader.
Yeah,
Just don't run for politics, or that old video will come up.
Oh, it'll come back. And you just had to fall on the sword early.
It's like the Fauci video where
That's it.
That's
the one. That's the one where they say masks are of no use.
Right.
And I think all of us can admit that masks aren't a miracle. They're
Right.
not going to fix COVID. But that, with combination of distancing, hand washing, is going to at least decrease. And what we're talking about is that R naught, which is the spreadability. And if we go above 1, we're spreading. If we're less than 1, we are having fewer cases. We just have to push that curve down just a little bit. And that's what we're in Kentucky. What we're seeing is the numbers are we're on a new plateau right now. And that plateau is running with many things open and things like that. We're going to stay right there, I think, for quite a while. But, I think it's working. We have not seen that huge spike. And the whole purpose of flattening a curve is not to say we're not going to have any cases. It's just to preserve access to healthcare and resources and to give everybody who gets COVID the best chance at beating COVID.
Which is fatality rate.
Mm-hmm. Yeah.
So-
We don't want anybody in Kentucky to show up to one of our hospitals and say, we cannot help you because we have no beds, we have no ventilators, we have no ICU space. Your family member is going to have to go home and die. We want every single person who comes in, even though we don't have great treatments for COVID, we still have done some things and know some things in terms of helping people get through it. We want everybody to get as much chance, no matter their risk factors.
I noticed, one of the big things at the beginning of this pandemic was ventilators,
Mm-hmm.
the number of ventilators, and that since has not really been a hot topic, and for two reasons, I think. Correct me if I'm wrong here. One is we produce more ventilators,
Mm-hmm.
and two, intubating someone is not necessarily the first course of action anymore.
One thing we've learned is that with this virus, humans with the virus can withstand much lower oxygen saturations than we understood before. If you came in with an oxygen saturation in the 70s before, you were on death's door. With COVID, we see people coming in with saturations in the 70s and they feel otherwise fine. And it's just a number, and you're like, there's no way that's right. There's no way that's accurate. But it is. The body is compensated. It's doing the things it needs to do. And you're absolutely correct. We've learned that intubation, we want to avoid as much as possible with COVID, because once people go on the vent, it just snowballs from there. So other things, prone positions, pulmonary therapy, just permissive hypoxia type things.
Yep.
Those are the things that we're doing. And we have seen a couple places where those resources have been pushed. New York, New Jersey. Most recently, some areas of Texas and Florida had a push to where they got close to exhausting the resources, especially the ventilators and ICU. But most states, and here in the Commonwealth, we have avoided that. And, every map that we have had so far since shortly after the beginning has shown that we're going to stay below that curve that requires rationing of healthcare resources.
Which is good news for everybody. Right. Because, and you alluded to this earlier, that one of the biggest issues besides the mental health side of it is that people are not going and doing their normal healthcare things, right? Like they're not going to get their colonoscopies and they're not going to get their heart checkups. And so a lot of that is has stopped, and I think the medical professionals are trying to get that kickstarted again. Am I saying that correctly?
Yeah, so we've had, and actually we just did a story with NPR this week about people delaying healthcare and having complications with it, and talking with some of the oncologists, actually the one we talked about before, about people who delayed care and have come in with an advanced state, not much to do. I've had folks come in with surgical issues that they've sat on for a couple of weeks. We've seen an increase in out-of-hospital cardiac arrest. We've seen a significant increase in the number of strokes that are presenting, and they're delaying care. Many times because folks thought the ER was closed, or they thought the ER was just for COVID, or they didn't have access to their providers, to their physicians, to their PAs, their NPs, the people to help guide them and to see them in clinics and things like that. And that was where we saw that 60% drop in ER volume in March and April, because a lot of that type of thing was going on, and a lot of people had complications because of it. I saw a lot of elective procedures that turned into emergent procedures because of the wait and the time that took place. And that's getting corrected now, and we're seeing that come around. But still, there is, I've seen a couple procedures delayed because somebody couldn't get a COVID test in time, and that's, they wanted to have the COVID test before an elected procedure, and so it's
yeah. We had a coworker that was going to go get it. And I didn't realize this was happening, but she was going to have eye surgery, and she had to go get a COVID test before.
Well, you think about an ophthalmologist and dentist, they're right up there in your grill. They're right up there in your face. I mean, they're on ground zero of exposure to COVID.
Well, she tested positive.
Yeah.
And no surgery. She had to wait.
Not for a while.
Yeah, so she waited until she got 2 negative tests in a relatively short period of time, 7 days or something like that. Asymptomatic.
And the question is whether that first one was potentially a false positive or even just an exposure. Like if I walk by somebody who's got COVID, I may breathe in some of that viral RNA, and it may still be there, but it may not be the viral load necessary for me to get infected. But it may be enough that I can pick it up on the tests. And that's the challenge. We have the antigen tests, which theoretically pick up acute and actual infection. The antigen test, which there's one that's
which is different from antibody.
Yeah, so the antibody test looks at your response. That has no value whatsoever in terms of acute illness type stuff. That is, was I exposed enough to it that my body has built a response to it? And at this point, we don't even know what the antibodies mean. Does it mean protection for a month, 2 months, 3 months, 6 months? The other coronavirus strains, the mild strains, only have about a 2 to 3 month protection after you have it. The more severe, like MERS and SARS, tend to have about a 2 or 3 year protection. And I think that's what we're going to be shooting for the vaccine, is looking for that MERS and SARS protection that you get afterwards, that it's decent enough that we're not doing it every single year.
So the vaccine wouldn't be a lifelong vaccine then?
I don't think it will be, because so far we have not built a lifelong immunity to any type of coronaviruses. And flu being a great example.
I hear one of the stats I hear a lot of is excess deaths. That, and I hear both sides of this argument. Some people say, "Oh, well, the excess deaths are COVID. That's how you can tell really what the real fatality rate is." And I hear other people say, "No, the excess deaths are really people that aren't getting their care that they normally would, and they're just dying from other causes." Thoughts on that?
No, it is used. It is a good indicator. So what you're talking about is excess deaths. If we look through year over time, so September 2020 versus September 2019 versus 2018, population adjusted, everything like that, how many deaths are we expecting during this time frame just with being the United States of America? Now, where are our numbers looking at from there? And then looking at those numbers above that baseline, above or below baseline. And we have been pretty consistently since after March, getting into April, May, and June, we've been above. We've had more deaths than we would have expected at that particular time throughout the year. And I think it does. It translates into a couple of things. A lot of them probably are COVID, but I think you are seeing a lot of things that are other causes too, delaying care procedures, ignoring symptoms. We're seeing not only the increased out-of-hospital cardiac arrest, but we're seeing significant decrease in bystander assistance for cardiac arrest. So fewer people doing CPR, fewer people helping people out. And so all of that
hadn't thought about that.
So all of this stuff, it increases those death numbers. And the biggest challenge is everybody's, you mentioned in the beginning of the program, the 6% stat. Well, what we are actually worried about, the highest number of complications we're seeing is the non-traditional COVID symptoms like the strokes. So COVID is a hypercoagulable state. with the immune system and makes the blood clot more. So we're seeing a huge increase across the country, but especially here locally in strokes, likely because of COVID. I have had more potential exposures from stroke patients than I have from anybody coming in with actual COVID symptoms that end up testing positive after admission.
So let me ask you. Let's step away from the professional point of view. I'm more concerned. I think our viewer would like to know too. As we mentioned earlier, there was so much information thrown out there. You know, from the CDC, from the president, from the governor, all over the place. Social media, all over. What is the best advice from you as a professional dealing with this stuff? Because we worry about people anxiousness, fear. You know, what is the best advice through faith and whatever your perspective? What would you tell our people?
Well, the most important thing is to be smart, but don't let this derail you. Don't let this hijack who you are, your life, your thoughts, your sleep, your wellness, your family. There's only so much that we can do with COVID. We can't prevent it 100%. I can't say that you'll never get it, and I can't say that you're guaranteed to get it. But what I can tell you is make smart decisions, wise decisions. Don't put yourself in harm's way. Don't go to a big, close to everybody get together. This isn't the time to start picking up the French approach to hugging, those types of things. But
I won't.
Yeah, okay. I figured. I'm not. You know, I don't know that you know you that well, but
You're not anti-French either.
No, I'm not. Absolutely not. It's beautiful, but it's just be realistic. Don't panic. And there's one thing we always talk about in racing is when we have an incident on the track and you get people on the radio or even the fire department and everybody gets on the radio and they start getting high pitched, talking really fast, being really loud. It's like prepare to panic. And I always tell my kids when they're dealing with challenges is spazzing out never fixes a thing. It doesn't make things better. When I'm in a code situation or somebody very sick in the emergency department, I walk in just like I am right now. Normal cadence, normal tone, no hurry, because you need your mind and your thoughts to be on point. Because the more we panic and the more we stress, the more we revert back to our brainstem, which is a very fight or flight aspect of our brain. And it is not designed to make big thoughts and break things down. And what happens, though, is that increases stress hormones, that increases the things that damage our vessels, worsen, chronic medical conditions, put us at increased risk. So just take appropriate approach, safe approach to COVID, but don't let it derail everything about you.
In your professional right now, am I right to say we learn a lot about COVID? Go see a physician to manage right away, right? Sometimes we see COVID compare to the death wish of, stage 5 cancer or something like that without, we get more panic about it. Instead of be calm and collective, let a doctor deal with you, symptomatic, and do whatever it need to take, right?
Now, if we try to go to herd immunity with natural exposure to COVID, we're going to have a little panic because it's going to take 50 to 60%, easily 60% of the population getting COVID. Right now, we're pushing known cases somewhere around 1 to 2%. Some areas are seeing about 10 to 20%. In certain areas in New York, New Jersey, areas where there are really hot spots. But most areas of the country are still well below that 1% mark. And even then, the death rate of the known cases is under 2%. And those are still very, overall, relatively predictable in terms of the risk factors of age and comorbid medical conditions, long-term care facilities, nursing homes, those types of things we talked about. Lexington, and 1/3 of the deaths in Fayette County have been from one long-term care facility, and not because of necessarily anything that was done wrong. It's just that type of setting spreads it with high-risk populations. And so, I travel with NASCAR, and I do the things I do. My family and I, my wife and I went out and ate lunch today together. And, we can make wise decisions. I walk into a place and I can tell whether they take COVID seriously. Do they have us seated in the right way? Are they wearing their masks? Do they have separations? Do they have clean surfaces and the things they do? They have availability to hand sanitizers, those types of things. If I don't feel they are, I turn around and walk out. I'm not going to put myself at excess risk, but I'm also not going to live underneath a rock until 2020 is over.
It's good.
Good advice right there.
I have a question. If blood clotting issues are an issue, why have we heard that ibuprofen was a deterrent?
So ibuprofen initially when it came out, and this was part of the scientific process that played out on social media, is initially very early was ibuprofen was considered a no-fly zone, that it may have increased the complications associated with COVID. Follow-up studies on that have found there's actually been no link with any type of adverse reaction or response with any of the NSAIDs, being ibuprofen, naproxen, any of those like that. And so you can still take those. We kind of recommend, just because of how that's kind of set, that people take acetaminophen or Tylenol if they have the fever or COVID. Aspirin is still okay, even though it still fits into that kind of NSAID category. But we actually do screening. And if people have certain test markers that we look for, D-dimers, ferritin, things like that, the inflammatory markers in the body, if you have COVID and you come in the hospital, we'll start you on an anticoagulant. Because we know if those markers are elevated, those inflammatory markers, that you have increased risk of some sort of clotting issue, whether it be a pulmonary embolus, so DVT, pulmonary embolus, which is DVT is a clot in the legs or arms, pulmonary embolus is a clot in the lungs, and then of course stroke-related symptoms. Then we actually do have screening protocols for that. But there's really not much you're going to do at home to promote that or prevent that. It's just if you start to have symptoms with COVID, following up with your healthcare professional to see if you need to be tested. I wouldn't run straight to the office or to the hospital because, again, 90% of people are going to be fine at home, or they're just going to manage this at home. About 10% have to be admitted to the hospital. If you start getting more severe symptoms, then coming into the hospital, letting us check things out, depending on your risk factors, over age 60, hypertension, diabetes, oxygen saturations, inflammatory markers, things like that, kind of determine our course of action.
When you say hypertension, are you saying uncontrolled hypertension or anybody that's on? Because I have hypertension. That's what I was just.
Well, of course, uncontrolled is worse. But a lot of people who have hypertension are kind of in the control is in a range where you'd still kind of be in that lower edge anyway. But, really more that uncontrolled, non-compliance with medications. It's amazing how many people don't take the medication. And there was a study that was done in emergency medicine that found of the prescriptions we write, 75% are either not taken at all or taken incorrectly.
No, I can vouch for that. I have people at work that come to the office and say, they look like death warmed over. And, well, I didn't take my blood pressure medicine. But, well, okay.
Or they come into the ER with uncontrolled blood pressure. And it's like, well, are you taking your medicines? No, I've been taking them for about 2 weeks. I'm like, well, let's start by giving you your medicines and say, oh, wow, that fixed the problem.
It's like a miracle.
Yeah, that's a really expensive way to determine that you should be compliant.
Exactly. You got any questions over here?
I got one right here.
Okay.
Back to vaccine. How can we trust a vaccine when the presence of a vaccine can't be recorded? If they don't have a complete diagnosis, how can a vaccine be universally effective?
Well, we don't know that it's going to be universally effective. In fact, with a vaccine, the goal is to produce herd immunity, meaning those that either can't take the vaccine because of a sensitivity, allergy, or they can't build an immune response, that they are protected by everybody around them that has that. And that's what we do with things like it was back in the time when it was like smallpox and things like that. But, the mumps, measles, rubella, all those exciting type things, they're still in the environment. We still see cases. Pertussis, we actually had an outbreak of pertussis here in Georgetown a few years back. Those types of things, that's the reason those don't actually get to the pandemic levels, because we have herd immunity that kind of contains it in. So with the vaccine, the vaccine is going to be... We've got 3 that are in phase, that I know of, that are in phase 3 trials right now, which is the final trial. That is generalized testing. The one out of Oxford, which is the AstraZeneca one, is testing on 30,000 people before it will be approved. And so the FDA and CDC says that, yeah, we are hurrying the vaccine. We are fast tracking, but it's kind of like when we went to the moon in the 60s. You put enough money and motivation, we can make a lot of incredible things happen. And but they've also assured, in fact, we had a meeting earlier this week when we were on with the CDC, and the CDC said we will not hurry the approval process. We are going to ensure that this is effective and it is, most importantly, safe before we approve it for the American public. And I think the question will be is how well it protects. And basically what we're going to see is once we provide this, is whether we see significant drops in the cases and risks and the immune response. But everything that's been shown so far with those that are in stage 3 is that they produce the immune response that is felt to be necessary to protect against COVID-19.
We're over.
We over?
We're over. That's
Ooh,
good.
man. We don't have
That means you'll have to come back.
Okay.
I haven't had a chance to talk about his faith yet.
I know. Well, maybe we'll have that as part 2. We'll talk about your faith. I do have a note here that you do go to Southland Church. Is that correct?
We do. We actually, when we first moved up here, I grew up in the Methodist Church. Actually, that's where I got into media. When I was 14, I started narrating the church broadcast, and for the AM radio station, because everybody knows a church broadcast, if it's just a radio, that there are a lot of gaps where there's not a lot of action. You know, there's singing, talking, that sort of thing, but there's a lot of gaps where we're making transition points, communion, whatever it may be. And you got to fill in those gaps. We can't have dead air. And so that's actually where I started in media when I was 14 years old. And my wife grew up in a missionary Baptist church. Her grandfather was a preacher of Eastside Baptist Church, Missionary Baptist Church in Franklin, Kentucky. And so she spent all of her summers doing revivals. And so when we got married, the Methodist and the Baptist, when we moved here, we were off of Southland, so we started going to Hillendale. And then when we had children, the programs at Southland allowed us to get them into children's programs, and we just moved south. We live on the south side of the Harrisburg campus, or Harrisburg Road campus, and so we continue to go there. So
it's a big church.
It is a big church. It is, but what I love now, one thing that's been great about COVID, is the fact that I have access to not only those services, but the church that I grew up in, their services. So when I'm on the road with NASCAR on Sunday mornings,
you can pick whatever you want.
I can catch 2 or 3 services, and
that's the same thing with the Catholic Church too. I mean, you have to be streaming some method, something.
Well, I mean, that's the most important thing when you're talking about, how do we reach new people? The attendance has dropped across a lot of the country, but how do we get the Jesus on? And that a lot of it is getting that information out there.
Well, we would like to convert you, but that'll take a couple of episodes to convert you to Catholicism. And typically,
at least one more.
At least one more. Typically, we give our guests. I think you're the first non-Catholic guest.
Correct.
So you go down in the annals of history as the first non-Catholic guest, which is fine.
I don't know if that's a compliment or not.
It is a compliment.
It's a great compliment.
It's going to be a really good compliment here in just a second, because usually we give Catholic guests, we give them a rosary, but he's not Catholic, so I can't give him a rosary.
Sure you can.
What?
What's stopping it? It's perfect.
But I didn't bring it.
Oh, no.
I brought something else.
Okay.
Oh my gosh.
Oh, no.
I brought a bottle of McKenna 10-year.
That is
A little birdie told me you might like that.
that is incredible, actually. That is a fantastic 3 years, best bourbon in the world for the San Francisco competition. Yeah,
it's good stuff for sure. So we appreciate you coming and being a guest, and we'd like to have you back sometime.
Absolutely, anytime. It's fantastic.
Maybe at the end of COVID, where we can play back some of this as a B-roll and say, look what he said then.
Yeah, look how wrong he was, even when they knew stuff.
We're going to cut out all those other stuff we do because, we're way over. But, again, thanks for coming.
Yeah.
Thank you, Don. Really
Hey,
good. Very informative.
Yeah, good conversation, good discussion. So next week we're back here in the studio with Father Danny Taylor. He's he was supposed to be on last week. We took a break. You got to take breaks now. We need like mental health days.
That's this weekend. This weekend for me is my first weekend off in about 3 months.
I mean, you got to do it.
Checking out.
I should be going fishing tomorrow, but instead I'm going to be on my bicycle, which I haven't ridden in a while, so I'm going to be back on the bike tomorrow. But Danny Taylor being with us next week. That should be a good show. Father Lynn has to take us out to dinner, so get ready for that.
Oh, is that right?
Yeah, Danny's coming up, and you're buying dinner for everybody.
Oh,
so.
I should did not know that.
Okay, well
Is it in
now.
their budget?
Yeah, it's in our budget. Yeah, we'll get to that here in just a second. 2 weeks ago, we were at Galvin's with Dwayne and Chrissy Ellison. I just want to remind everybody, the Findlay 5K packet pickup is tomorrow. So if you signed up for that, check your email. You should be able to get. Did you sign up?
Of course, and
Okay.
donate.
Did you sign up?
Not
Great.
yet.
Okay, you can't sign up. It's too late to sign up.
The
But
only
hey, I
time-
signed up.
The only time I not run the 5K still got a medal.
Okay,
That's how I said
you're
it.
going to get a medal, the virtual.
Can we make one request here at the end? Is that we all just do a real round robin of just changing real fast so we can watch Steve's head explode trying to change the cameras?
It is pretty good, but you can't sign up for the Findlay 5K, but you can donate. Findlay105.org. They're doing some good stuff for SIDS, and we heard about last week about how there's not a lot of research going on
Correct.
because of funding. There's no money in SIDS research. There's no miracle drug. So if you feel so inclined, please donate. Great cause. Hey, if you're just joining us for the first time on this broadcast because you like one of Dr. Ryan Stanton's numerous Facebook page or follow him on Twitter or whatever, we invite you to like our Facebook page and our YouTube page, Saints Francis and John. Just search for that. You'll find it. If you're watching this broadcast, you've already found it. If you're listening to us on a podcast, you're one of our fans, check out the docs pages. Go ahead.
So on Facebook, we got this Stanton MD Everyday Medicine. That's the general information. That's where I put all my COVID updates. We have ASAP Frontline, which is the podcast, and then we have The Doc is In, which is the weekly TV segment that's on WKYT here in about 6 stations throughout the Southeast. That's just topical segments, which in 2020 is COVID.
Everything COVID.
Everything COVID.
Everything COVID.
Nobody wants anything but COVID.
COVID. So when we have you back, we won't talk about COVID. That'll be a rule. How about that?
That's going to be a short show.
There's a lot more to talk about. So yeah, like and follow all of us on all of our social media accounts. Check it out. Latest posts, events, all that stuff. Also, if you're so inclined, ssfj.org, ssfj.org. That's the parish websites for financial donations. We're a church. We have no money.
Always need money.
So we always need money.
For
so
ministry.
if you like our ministries, you like what we're doing, all we're trying to do is spread the gospel. That's all we're trying to do. And you can help. So tell your friends about us. Hit like. Hey, Father Lynn, can you give us a blessing? It's your turn.
Sir. Well, before we say blessing, 9/11 is very important.
Oh, that's true.
It's a
forgot
great
about
day
that.
to commemorate and remember the gift of freedom when so many people die, and tragic for this nation. But at the same time, give us a willingness to rise together as a community of freedom that we witness for this great country. Gracious God, we give you thanks for our life together, your faith during this difficult time of this pandemic. We give you so much thanks for your many intelligent people, science, doctor, willing to explore and try to end this pandemic. Yet we do know there are many people suffering to this pandemic, to fear and doubt and sickness. We ask to send your grace and blessing, especially on this 9/11. We lift all the dead, those who are victims of that crime. We trust your mercy and your eternal hope and love. And bless us this evening. Bless all those who listen to us, and bless all those who are longing for faith and love and hope during the difficult time. We ask this in Jesus' name.
Amen.
May Almighty God bless you in the name of the Father, of the Son, and of the Holy Spirit.
Amen. Great show. Thanks, Doc.
Thanks,
you
Doc.
guys.
Thanks, everybody. And until next week,
Thanks, Steve.
I'm Deacon Tim.
I'm Deacon Dallas.
Father Lin
Good night, everybody.
Good night.
Did you ever stop and think, why spend too much time just getting ready? Let me be honest, I don't know a single thing that I haven't done to make you notice me. Let me be real here. When I see you, my heart starts racing, but I don't know if I like this chasing and playing and waiting around. It's a shame that my hands